Aloha, everyone. I'm Dr. Tom Johnson from Kalani Total Health Center. Today, we're continuing our discussion on chiropractic care for school-age active kids, teenagers, and student athletes of all ages. Today, we're discussing specifically the common conditions, the common diagnosis that we typically see in these age groups, as well as we'll discuss how we treat them as well. Let's start with just common conditions. Let's review what we talked about in our last video. The healthcare options for this age group are typically based on Western medicine, allopathic medicine, with your pediatrician, your family physician, any medical specialist, surgeries, or emergency medicine. Now, let's make real clear, these healthcare providers are essential to our day-to-day health and wellness for our families. They save lives every day, and we're extremely thankful for all of them on the front lines. However, what are the healthcare options for our day-to-day slips and falls, aches and pains, common mild to moderate sports injuries that don't involve colds or flus or frank gross trauma or emergency medicine? That's what I want to discuss today with you, the common conditions. Well, let's talk about several, starting with our younger kids at home. As we learn to walk and gain balance, we go through a series of slips and falls. We have poor sleeping habits, poor posture habits. Going to school, we have injuries on the playground, injuries in the classroom with static postures, sitting for prolonged periods of time, learning to read and write. Those heavy backpacks that we wear incorrectly, or we pack for too many books. This then translates into our active kids in sports, park and rec leagues. Again, sports-related injuries, overuse injuries, repetitive motion injuries. We can get into the club level, the elite level of sports, of our student athletes as well. And it continues. It's more aggressive with more practice during the week and more games on the weekends, typically tournaments. Talked about our teenagers that are on these massive growth spurts. They're growing tall very quickly. They have general aches and pains associated with just growing and the poor posture. So injuries can be classified into a static posture-related injury, more of a motion, repetitive motion style of injury, or a specific injury to the body, typically spinal injuries, neck and back, shoulder, upper extremity shoulder, elbow, wrist, hand, lower extremity, hip, knee, foot, ankle as well. Again, these are the typical musculoskeletal type of injuries that essentially can be classified into arthralgia, joint pain, myalgia, muscle pain, and neuralgia, nerve pain. Again, these are the typical, most common diagnoses we see every day. We've been seeing this population of patients for over 20 years and getting great results, providing natural, safe, and effective care for these populations. This process starts, though, if you review some other videos, like just coming to the clinic and sitting down with our best doctors and going through your health history and injury history and goals of care, performing a comprehensive physical examination. From there, we can prescribe a specific treatment plan for those injuries and the goals of care that the parents and the patients have as well. Furthermore, we're really active in performing and helping patients and players and athletes get to the next level in terms of sports performance. And so we can customize the diagnosis, the examination, diagnosis, and treatment plans based around that sport-specific goals of that patient or parent. Again, we are specialists in this field. I hope today you can see that we want to separate what typical Western medicine doctors and providers will provide for you in terms of acute care, disease care, emergency medicine care, and where we can fill in the gaps in terms of being a specialist in this spinal care, musculoskeletal care, sports injuries, sports medicine, sports performance. Again, I'm Dr. Tom Johnson from Kalani Total Health Center, your one-stop holistic health shop. I'm looking forward to seeing you on the clinic. Don't hesitate to call the clinic if you have any questions or concerns. Mahalo and aloha.